You're watching a special edition of 22 News at 5:30. We are talking about COVID-19, the vaccine, and we're talking about a safe return to school. So joining us once again here is Bay State Health President and CEO, Dr. Mark Kerouac. I want to ask you this because there's been a lot of debate over this. The CDC recently actually released a roadmap for how schools can safely reopen during the pandemic. Do you think that it's safe for students and teachers to be back in the classroom?
Well, I think if the right things are done, it can be done safely. The CDC, as you say, Don, issued some guidelines just last week based on an extensive experience in some very large cities like New York City and Providence, Rhode Island, that have been able to keep their schools open either completely or partially for many, many months now. It is based on a sort of layered approach that includes masking, social distancing, hand washing, as well as improved ventilation in the schools. And the results have been acceptable and impressive even in many of the school systems. It also is linked to how much virus is in the community. Currently, there's a lot of variation from town to town, from some towns, say in Franklin County, which have very low levels of virus, to cities like Springfield or Holyoke, where the levels are higher. But even with higher levels of virus, elementary school kids can go back part-time according to these guidelines. We know that kids don't get infection as commonly, don't get it as severely, and don't shed as much virus, and therefore are less infectious when they do. So if the proper precautions are followed, then that should be able to be something you can get away with. The other things that the guidelines call for are for teachers to be prioritized for receiving vaccine, and they are one of the priority groups in phase 2 in Massachusetts. But that's not felt to be an absolute precondition to getting schools back open, at least partially.
Okay, and do you think that the vaccine prioritizing teachers and students, for example, to get the vaccines a little bit earlier in the distribution process, do you think that that should happen here in Massachusetts?
Well, teachers already are in a priority group. Students are not, because the vaccine has not yet been tested in young children under 16 or 18. And there is a question of trade-offs. I think that it's hard to say that you're not going to prioritize people over 65, given that they have a higher fatality rate when they're infected, or people whose positions get them in less controlled circumstances, people working in large public areas, say like restaurants or grocery stores, et cetera. But teachers are in among that group of so-called essential workers, and they should be the ones going soon after the people in the 65 and older group.
I was going to ask for just a little bit of clarification on that. With teachers, with children, students, do you know when they would be vaccinated?
I think that it is really up to the governor to decide when to move from one stage to the next. As you know, just this week, we moved from the over 75 group to the over 65 group, and it's based on a judgment call as to when the majority of people who are going to be willing to get the vaccine have in fact received it.
All right, Dr. Kerouac, thanks for that insight on. It really has been a controversial topic. We're going to continue our conversation here. Up next, we're talking about what's become another controversial issue, the state's COVID-19 vaccine companion program. You're watching a special edition of 22 News at 5:30.